Hello, everyone. I'm Karen, and thank you, Steph, for acknowledging the traditional owners of the lands on which we're meeting today. I'm joining you from Garramilla on Larrakia country, and with me is Elle, who is the Knowledge Manager for Information Resources with the ADF's Evidence and Information team. Elle is joining us from the lands of the Muwinina peoples, the traditional custodians of Nipaluna. So I would like to pay my respects to Larrakia elders past, present and emerging, and to the Muwinina elders, as well as the traditional custodians of the country you're joining us from as well. Before we talk more, I'd also like to mention that today is Are You OK Day? And many health and community service workers are drawn to this work because we care deeply about the well-being of our communities and the people around us. So if you feel like seeking support for yourself, there are some phone numbers on screen here. If you need to step away during this discussion, please feel free. And a little later on, we'll share some of the resources that the ADF has for health professionals, for family and friends, and for people who are looking for support with their own alcohol and drug use. So thank you for coming along to this presentation on how the ADF works with communities so that we can grow strong and healthy together. I'm the Northern Territory Regional Community Development Manager, and today I'd like to talk to you a little bit about who we are and what we do. I'll share some of our success stories, and most importantly, we'll discuss how we can help each other build stronger, healthier communities. The Alcohol and Drug Foundation is Australia's leading drug and alcohol harm prevention organisation. It was established in 1959 by war veteran Sir Edward Weary Dunlop as a compassionate, health-based response to alcohol and drug concerns. We're an independent non-profit, and our evidence-based work is funded by state and federal governments together. How we work. The support of local communities goes a long way in helping to prevent and minimise the harm from alcohol and other drugs. It's at the heart of everything we do. We recognise the power of strong communities and the important role they play in preventing problems happening in the first place. Nationally and internationally, there is evidence of the importance and efficacy of community engagement and participation in AOD prevention. Local knowledge and local skills and services can help to ensure that any project or programs implemented are relevant, appropriate, and more likely to succeed. Further, Australian communities are diverse and constantly evolving. We need to make sure every one of them feels heard, supported, and prevention ready for the challenges ahead. To do this, we work hand in hand with local groups, supporting them to develop and implement programs tailored to their specific needs, tackling specific concerns in their area. We understand that a one-size-fits-all approach doesn't work. We provide support and the resources needed to deliver alcohol and other drug prevention programs. All our resources are based on evidence we have gathered around what works best, so the communities we work with feel confident designing their own solutions. The ADF's overall strategy involves both prevention and minimising alcohol and other drug harms to individuals, families, and the wider community. We can use prevention to address the causes of alcohol and other drug problems before they happen. Problematic alcohol and other drug use is known to be influenced by a range of modifiable risk factors that operate at the community level. For example, availability, marketing, community attitudes and norms, community disadvantage, the prevalence of alcohol and other drugs, and so on. There is good evidence for a number of community-based programs, including those focused on preventing youth tobacco, alcohol, and other drug use. Harm minimisation initiatives promote safety for those who already use alcohol and other drugs and provide access to non-judgmental information. For the Alcohol and Drug Foundation, this includes evidence-based resources to help people make informed decisions about the harm to themselves, family, and friends, and the wider community. It also means working to reduce the stigma associated with alcohol and other drug use. We support positive changes to infrastructure and policy through our advocacy work, which focuses on ensuring that alcohol and drug policy is grounded in evidence about what works and that appropriate investment in preventing alcohol and drug harms are made. By ensuring that the community and policymakers have good quality information and advice, we can break down barriers to help seeking, reduce stigma, and prevent harms from alcohol and other drugs in our communities. Our programs impact a wide range of people, from those working in health and community services to the people in the communities that they work with. Our resources are used by health professionals, emergency services, community health workers, the general public, the media, and universities. They also drive community grassroots programs aimed at really diverse audiences, from high school students needing preventative programs to school leavers who need information and guidance, from pregnant women and parents to sporting club volunteers and members. Prevention works best when it involves change from the bottom up. That's people and organisations acting for themselves, becoming more resilient and less vulnerable. At the ADF, we know communities understand their local circumstances best. We work with communities to strengthen protective factors and support positive long-term change. Our key programs are Good Sports, local drug action teams that are community-led, and a comprehensive range of factual information services. In the Northern Territory, we support, it's currently 278 Good Sports clubs and 8 local drug action teams to prevent and reduce AOD-related harms. They're spread right across the Northern Territory. First, we'll look at the Good Sports program. It's Australia's largest and most successful community health promotion of its kind. It reaches over 3.2 million Australians, and after 25 years of hard work and collaboration, there are now almost 13,000 sporting clubs who are part of the Good Sports program. Good Sports clubs are community leaders, helping to disrupt the link between alcohol and sport, reducing risky drinking and children's exposure to alcohol. With the free Good Sports program, clubs can create an environment where everyone feels welcome. As many of you know, these clubs are run by busy volunteers who already have a lot on their plate. Because they're at the grassroots level, they can see when problems develop. They just need some help tackling them in a caring and effective way. That's why the ADF supports clubs through the whole process of increasing their awareness and implementing the Good Sports program. We work with clubs to identify strategies that work in their unique environment to effect the change needed and make their clubs the best they can be. The program is also fully online, so clubs can work their way through the program at their own pace using our online portal. It can be accessed by multiple different community members, which is great for embedding this learning within the club environment. And it tracks the club's progress as they put into place their evidence-based action plan and progress towards gold medal accreditation. Independent evaluation has shown Good Sports reduced risky drinking at participating clubs by more than a third. It's seen a reduction of alcohol-related accidents amongst Good Sports club members and supporters by 42%. Research also found that Good Sports prevented around 1,300 alcohol-related falls, assaults, and road accidents, saving about $14 million for the Australian economy in just 1 year. Modelling actually suggests that $4 of economic value is returned to the community for every dollar invested in Good Sports. We've got some stats on the screen here. Clubs see a 37% decrease in risky drinking and that previously mentioned reduction in alcohol-related harms. They also have an 8% reduction in their odds of drink driving when compared with non-Good Sports clubs, and that's for each season a club was in the program. Clubs also saw significant increases in their confidence to manage illegal drug issues, increased awareness of mental health, and club members also told us they felt an increased intention to seek help for mental health issues if they needed it. So alongside the stats there's a great recent photo of the Plenty Highway Football Club who have come together around Harts Range, and they're working with the Right Tracks program there, which we also support. Of course, it's not just about dollars and numbers. When they go off to training or take to the field or the pool, young people aren't just learning how to kick goals or score runs. They're picking up habits for life. With Good Sports, we want to help make sure that they're positive habits. Good Sports is not just about kids, it's teens and young adults in their sporting prime. It's mums and dads who might not be playing anymore, but if they're like me, they're probably still at sports 6 days a week. And we're not forgetting seniors who know that staying active and connected with the community is the secret to a long and healthy life. I have a quick video here. Now, I'm sure we're probably have seen people struggle to share these in teams before, and I'm going to be one of them. So I think looking at the time, I might even just suggest to you all that you head to YouTube and you can search for Good Sports, Palmerston and Regional Basketball Association. And as a Gold Good Sports Club, the PABA has become really entrenched in their community, offering walking basketball, social inclusion basketball, drop-in sports and night games, as they've really made a difference and supported the wider community in Palmerston. Our second core program is the local drug action teams. This is a wide range of activities that are set up and guided set up and run by local organisations with help and guidance from the Alcohol and Drug Foundation, thanks to Australian government funding. The main aim of the local drug action teams is to prevent and delay use of alcohol and other drugs in local communities. Local drug action teams do this by delivering evidence-informed activities that seek to prevent and delay AOD uptake, increase awareness of strategies that individuals can use to reduce their own AOD harm, promote their own well-being, or strengthen protective factors and reduce risk factors for their community. A local drug action team is a group of organisations who form a partnership to address alcohol and drug issues in their local community. People and groups like schools, health networks, police, community groups, businesses and government officials come together. We call them LDATs because Local Drug Action Team gets a little lengthy after a while. So while we try to avoid acronyms, if you hear me talking about LDATs during the rest of this presentation, I'm slipping into it. LDATs have a lead organisation for governance purposes and at least 2 other community organisations as members. So these, as I said, these can be a wide range of organisations from local government, schools, businesses, Aboriginal leaders, individuals or community groups. Members of the LDAT unite to lead community activities. They are community-led and the role of the Alcohol and Drug Foundation is to support the local drug action team to increase their ability to identify local issues and their skills in responding. Each local drug action team identifies their own issues through community consultation. Using local data and ADF resources, they then work with the ADF to create a community action plan. These community action plans always come from community, so we never tell people what to do. They're community-led and we support with the evidence base. The CAP outlines the evidence-informed activities that the LDAT will implement to reduce harm and increase protective factors. They conduct consultations, work with community partners to decide what type of activities would be most effective to tackle a specific local challenge, and they create capacity by bringing together aligned services with a holistic framework that looks to build on strengths or fill a gap identified together. Now, I'd like to share with you an excellent example of local drug action team work in the Northern Territory from the growing Strongbow Way with the Bunajal Strongbow Women Group. The challenge there was to support elders' work and their desire to provide more holistic supports for women, children and families, to promote cultural connection and well-being, and to empower women's voices, leadership and enterprise. The name Strongbow Women Group is Creole for Strong Women's Group, and it has grown through the elders' work and desire to, that is the same thing that's on the slides again. It began in the late 90s with women from many different language groups from around the region, And in 2021, the Jarwin Association joined the local drug action team program. The women's group was already doing great work around their communities, around alcohol and other drugs, suicide, domestic and family violence, and culturally led healing from a wellbeing perspective. To plan and deliver the Reconnecting the Songlines CAP, the local drug action team partners with the Miriam Rose Foundation, Green River Aboriginal Corporation, Sunrise Health Service Aboriginal Corporation, and the Nyurungulung Rise. Activities took place in Beswick, Barunga, Katherine, and Daly River. Under this community action plan, the local drug action team facilitated 7 community consultation and planning meetings. Of the 47 community members who attended, 80% felt they developed a network of peer support and cultural connection across the region. Because it's a culturally led initiative, developed and organised by Aboriginal people for Aboriginal people, the majority felt safe to discuss the impacts of alcohol and other drugs in their communities and strategies to prevent harm. Together, they designed 6 cultural camps, which were held during 2024 and reached 270 people. This included a 5-day ancestral songline walk on the Jutbala Trail at Nipmaluk with elders and youth, and a corroboree at Barunga Festival to showcase the Reconnecting the Songlines dances and ceremonies. In evaluation, 100% of participants reported that they felt supported by their peers and elders, and they have a strengthened connection to culture. They also felt more empowered to be their own health and wellbeing advocates and ask for support. So some of these pictures that are throughout here when we're showcasing NT activities are from the Jarwin Association, from these local drug action team activities, as well as on the main page when back there was one of Right Tracks conducting a workshop in Harts Range. So the thing is, everyone has the power to impact change. Whether you're a local drug action team, a good sports club, a member of your community, or an alcohol and other drug health professional here today, we've got our online community club, community hub, it's not a club, freely available to all. It's a fantastic practical resource that helps individuals and groups to reduce the harm from alcohol and other drugs. There's a QR code on screen there, and that will link directly to the community hub resources. So whether you're just starting out or you've been working in your community for a long time, there's evidence-based, simple to use tools there that can help successfully develop and run prevention projects in your local area. So the third core Alcohol and Drug Foundation program is a suite of online and SMS services that gives access to the most up-to-date information and statistics about the impact of drugs and alcohol. For over a decade, the ADF has been reviewing a wide range of information from across the sector to keep all our databases up to date, accurate, and relevant. The information is available to the general public, health workers, and researchers, and it's there to support them in their efforts in minimising and preventing alcohol and other drug-related harms. This QR code links directly to the adf.org.au website and the resources that we've developed for health professionals. So I'll just quickly mention those on screen now. The Drug Information Directory is Australia's leading alcohol and drug research directory. Health workers can find reliable information on alcohol and other drugs, mental health, links to treatment services, research statistics, guidelines, policy, campaigns, events, and more. There's also Path to Help, which is an intuitive online tool where a person can put in, it will ask simple questions to make a high, medium, or low risk assessment of a person's alcohol or drug use. You can access it for support with your own or another person's alcohol and drug use, and it will automatically search over 10,000 Australian support services to provide the best match based on need and location. There's more information services that are providing easy to find information on our website. There are drug alerts that are constantly updated. We've partnered with the Know there to make sure that the latest information available to the public is shared in the scrolling banner across our website. We have the drug facts page with information on around 60 different drugs, and the text the effects SMS line is a confidential SMS service where people can text a drug name to the service anywhere, anytime, and receive an instant SMS reply. The reply explains in easy to follow language the effects of the drug, as well as links to further information and help. We're always adding new spellings and street names to help as many people as possible increase their knowledge. So definitely try it out, send a text to that phone number, and if it doesn't recognise the drug name that you're putting in, then it goes on a list for our information services team to consider. So yeah, definitely challenge us. Our newest information service is DIB. We've just launched this AI-powered drug info bot. It's the first of its kind in Australia, and it's a friendly, knowledgeable chatbot who you can talk to via message on our website. It gives anonymous, non-judgmental and trustworthy information about alcohol and other drugs. It's using DIB is straightforward. Type your question into the chat and get accurate, detailed answers explained in a way that's easy to understand. If you're not quite sure what you're looking for, relevant follow-up questions will be suggested to you. And now, to give everybody a little bit of a break from me, I'd like to reintroduce Elle, and Elle will speak to a new resource we have for health workers, the Lived and Living Experience resource.
Thanks, Karen. Hi, everyone. I'm Elle. So I lead the team that creates our evidence-based resources at the ADF. Predominantly, our focus is on translating evidence into accessible information for the community, as well as healthcare workers. Each year, the Department of Health Victoria funds us to write a couple of larger pieces that look into priority topics more in depth. And our aim of this resource, the Lived and Living Experience resource, was to highlight some of the top-level insights on LLE and then direct people to HRVIC and SHARC for expert guidance on best practice. Essentially, I see a really important part of our work is just like highlighting the important organisations out there who already have expertise in certain areas. So this resource, we worked closely with SHARC and HRVIC to ensure that we accurately captured the key issues for both those with lived and living experience. And we also worked closely with the Department of Health Live Experience branch. Karen, could you just flick to the next slide, please? Thank you. So this resource was really prompted by ongoing chats with the department around the growing importance of LLE in the AOD sector. It was aimed at bolstering the LLE discipline frameworks that SHARC and HRVIC created with the Department of Health. And these frameworks really aim to articulate the knowledge, skills, and scope of practice for each LLE workforce discipline. They also guide on training and development and allow LLE workers and their managers to gain greater clarity on their roles. So in our resource, we defined that lived and living experience means a person draws on their current or previous experiences, expertise, skills, and insight to benefit others, improve systems, and advocate for human rights. And importantly, these benefits also extend to the community, so improving people's access to equal and fair treatment, quality healthcare and support, and protecting their right to dignity and respect. LLE can be both an individual's first-hand experience and or the experience of supporting someone close to them as a family member, carer, or supporter. So in Australia and internationally, lived and living experience is increasingly being recognised as key to informing the design, delivery and evaluation of alcohol and other drug services to ensure that they're more adequately meeting the needs of communities. So we're just really hoping that this resource is a nice introduction to the importance of LLE for people and that it directs them to the experts in the sector for further information and support. And you can find it on our health professionals resource page on our website. Thanks, Karen.
Thanks, Elle. Now, we'll note that as this resource was developed in Victoria, the referrals in there are to Victorian services, Now, I reached out to Arden for some up-to-date referrals for some people doing great work with LLE space in the Northern Territory. And the good news is that it was quite a long list of services. And unfortunately, capacity constraints meant that I couldn't get in touch with everybody prior to this webinar, and I didn't want to leave anybody out. So I would suggest that when you are considering working with people with lived and living experience and embedding it into your programs, a great starting point is Ardent and the Ardent membership. There's a lot of people doing really good work. And of course, the NT Lived Experience Network, who are representing people with lived experience in the work that they do. So as you can see, the Alcohol and Drug Foundation is having an extraordinary impact in helping people, families and communities all across Australia. We're also lobbying behind the scenes for policy reform around alcohol and drugs. We want to keep these issues on the public agenda by working with other organisations and maintaining a strong media presence. So we can't do it without you. In a nutshell, going back to the start of this presentation, we're stronger and healthier together, and we'd love to work with you. I'll put it out there. There's a couple of great opportunities for you to get involved with the work that we're doing coming up. And we mentioned the importance of community consultation with the local drug action team program. We always make sure that we go back to the communities that we're working with so that we can share what has been happening, what's worked and what hasn't, reflect those successes and respond to current needs. One of the really well regarded aspects of that program is that we do provide time and funding to people to carry out that consultation in a way that's appropriate for where they are. And some of those local drug action teams are about to begin a community engagement and mobilisation activity, which is the community action plan designed to meet those needs. That will be happening soon in Palmerston, where the local drug action team is led by the Y, as well as in the Central Australian region, where the LDAT there is led by Congress, working with the Right Tracks Foundation in Harts Range and Hermannsburg. They'll also be checking back in with those communities, and we strongly encourage health services and all sorts of allied services to come together and be part of that conversation, even if you're not in the right place or the way the activity develops, that your service may not be involved in the long-term delivery. Making sure that we have as many voices in this conversation ensures that the response is appropriate. So yeah, get in touch with me. You can type adf.org.au into your search bar, and if you're going right through the contact details there, you'll also find mine. You can check out our resources at the Community Hub and the online shop. And if you have any further questions, you can always get in touch with me directly. So no QR code there, but take a photo of it or quickly write it down. So thank you. I'll now open it up so that if anybody has any questions for us, we're here.